my name is Dr. Robin Abramczyk, and I'm a holistic dentist in Heath, Texas. The name of my practice is Smile Ranch Dentistry, and I am here today at Alvin Birthing Center with my very good friend Teri Mitchell. She is a certified nurse midwife. She also has a doctorate in nursing, and I would like for her to share with you today about whenever a baby is first born, what is the assessment that she does on newborns?
Well, when a baby is first born, of course, we want to make sure that their color is good and their tone is strong and they're breathing well. And once the baby's had an opportunity to bond with its mother and perhaps have its first feeding, then the nurse midwife does a comprehensive head-to-toe physical exam on the baby. And one part of that physical exam is definitely a really good assessment of the baby's mouth and their oral function, their tongue, and how well they can suck, and also the range of motion of their tongue.
Interesting. So if you do identify an issue, what would that look like?
Well, the one quick and easy check, if there's other midwives who think, what's the one thing I should check for? That would be, look at the baby's mouth when the baby's crying. We want the baby to be able to raise their tongue at least halfway to the roof of their mouth, so about 50%, which would be about where the baby's lips meet. So when the baby's open and crying, if the tongue comes up at least 50%, then they need that as a minimum to remove milk from the breast.
Interesting. So what if it's not elevated to that 50% mark?
Then that's a sign of oral restriction, which means that the baby might not be able to effectively or efficiently remove milk. It also might mean that that baby's mother might get some sore nipples during the process of nursing her baby.
Okay, so you're looking at them when they're crying. What about when they're latched onto mom? Can you identify some restrictions then?
Yes, when they're latched on, we want to make sure that the tongue protrudes beyond the gum line and the lower gum, and also that the upper lip is really flanged nicely, and baby can open nice and wide and take a nice deep latch. And if the baby is not doing those things, of course the first thing we would want to do is just correct the latch technique and see if we can achieve that deep correct latch just through various position changes and latching techniques. But if not, then it might be time to consider if the baby would need a revision of the frenulum under the tongue in order to achieve the full function.
Okay, so how often would you say that you identify a restriction?
I would say that I visibly see a frenulum most of the time, but there's an important distinction between visually seeing a frenulum and having an oral restriction. And the main way to diagnose a tongue tie or a lip tie is through symptoms. So if the woman has symptoms or the baby has symptoms of oral restriction, such as persistent sore nipples or damaged nipples despite proper latch on, or a low milk supply despite her body having the ability to produce milk, baby not gaining well, low output, not as many dirty diapers as we want. Those kind of things would be indicative of the baby needing a revision, potentially. And so at that point, we would really say, okay, let's go ahead and talk about the next step. We've tried everything else to get over the challenges that that woman is experiencing, and that would be when I would refer them to a great skilled dentist such as yourself to go ahead and have that released.
Okay, one last question.
Sure.
So once the baby has a revision, if it's indicated, what is their treatment like after? How do you work with the mother and the baby after?
Well, one thing I really promote for them to do before they go for the revision is I like for them to practice how to do the oral exercises, because after the revision there is some stretches and aftercare that should be done. So if I have time, I try to teach them how to do that before the revision is done. Yes. So both the parents and the baby are used to doing that activity. So I encourage them that they're going to need to do these, and then that they should also follow up with a body worker, either a chiropractor or an occupational therapist, or someone who can help the baby reach full potential.
Absolutely. Thank you so much for joining us today. Thank you.